welcome to my channel. Today we're going to speak about the nerves supply to the leg. The thigh, this is a cut section of the thigh and obviously it's a femur. What I'm going to talk to you about is the thigh is divided into three components. This is the anterior component, it's the medial component, and this is the posterior component. You can make out the posterior part. I've drawn a little bit bigger, the buttocks part. What is the nerve supply? This is very simple. It's divided into anterior component by the femoral nerve, got the posterior component, the sciatic nerve, and the medial component is supplied by obturator nerve. This is the main nerve supply. And femoral nerve is a 10 marks question, sciatic nerve is a 10 marks question, and obturator nerve is a 5 mark question, or anything. Do remember, a 10 marks question may come for 5 or even for 2 marks. Let's go and study about the 10 marks question called sciatic nerve. Sciatic nerve is one of the chief nerve of the posterior compartment of thigh. Just we studied about that. Do remember, it's the largest branch of the sacral plexus. Go back to my video of the lumbosacral plexus where I'm explaining the sciatic nerve. It's the thickest nerve of the body. It's in its upper part. It forms about a band. This is a band which forms a band about 2 centimeters wide and it begins in the pelvis and terminates at the superior angle of the popliteal fossa. Popliteal fossa, I'm sure you know about the popliteal fossa. It's a fossa completely behind the knee joint, you know, the typical this type of fossa. Go back to my video. I will send a link for you there. Just go and see about the popliteal fossa knowing in under 4 minutes. This particular nerve originates from L4 to S3. It has a tibial as well as a common peroneal component. The tibial component arises from L4 to S3 and from the ventral divisions of the ventral rami, and the common peroneal component arises from L4 to S2 and dorsal divisions of the ventral rami. This is very important for us to understand the sciatic nerves. 2 components, tibial as well as the common peroneal. It's the largest branch of the sacral plexus, so the course of it's very important. Its root value, as all of you know it's starting from L4 to about S3, made up of 2 parts. And its course in the pelvis, it lies in front of the piriformis. After emerging from the greater sciatic foramen below the piriformis, and now it's, of course, it has a facial covering here, and then goes downwards and slightly laterally. It has to go towards the ischial tuberosity because this particular nerve will have something. This is the diagram I have drawn for you showing the femur. I have removed all the muscles here, only showing the relations. This has got in superficial relations, that is a gluteus maximus, and the long head of the biceps femoris. This particular diagram which I have drawn for you. The superficials are there is a gluteus maximus, and this is the relations of this thing, and deep relations are the body of the ischium. 1, obturator internus. 2, it has got related to the superior and the inferior gemellus, quadratus femoris, as well as the adductor magnus. This is a very important superficial and deep relations. Obviously, it is related medially also. There is something called as medial relations to the inferior gluteal nerve vessels. This is what it is. It has a superficial as well as deep relations. Just observe this video. This you need to write in a paragraph sort of thing explaining, because in the thigh, the same nerves enters the back of the thigh, the lower border of the gluteus maximus, and goes vertically downwards. And then further it goes on to having certain relationships, both in superficially it's crossed by the long head of the biceps femoris and related to adductor magnus, and most of the muscles it's related there. Now this particular nerve, please I hope you can see this. It's got branches, articular branches that is going towards the hip joint that arise in the gluteal region. They arise, and it's got a muscular branches which is nothing but a tibial component supplying the semitendinous, semimembranous long head of the biceps femoris, ischial head of the adductor magnus. This is what is the supply of this particular nerve. Just drawn a better diagram than this. So it comes downwards straight like this, and towards the popliteal fossa it's dividing, going towards the tibial as well as in common peroneal component. Then the common peroneal component only supplies the short head of the biceps femoris, and this particular nerve, before I go into that, I'll just come back to this later. This is what its component, a tibial component. Do you remember this is the sciatic nerve. I'm showing you the back of the leg. It comes downwards and then divides into 2 parts, a common peroneal and a tibial nerve. This very simple diagram. Okay, this tibial nerve arising behind the popliteal fossa area, the popliteal fossa region, and then it descends from the superior angle to the inferior angle of the popliteal fossa, from the superior angle to the inferior angle of the popliteal fossa, just giving off branches such as the superior medial geniculate, middle medial geniculate, and the inferior medial geniculate. This is the first packet. Then the tibial nerve has second component, the cutaneous nerve, which is called as the sural nerve. Do remember, it's a 2-mark question. To this nerve comes with sural. Nothing, it doesn't do much. It just supplies the skin of the lower half of the back of the leg, the entire lateral border, this is the lateral border to the tip of the toe, the sural nerve. And it has got certain muscular branches also, which go and just supply the lateral. See, this is a tibia, this is the back of the leg. The only big muscle which occupies this entire region will be your gastrocnemics, both the lateral as well as the medial head it supplies. It also supplies the soleus muscle, it supplies the plantaris and the popliteus. This is a tibial component, but the tibial component is not completed. It has this particular thing curved nerve to the popliteus, which instead of supplying to popliteus also supplies to the tibialis posterior. Both the superior as well as the inferior tibulofibular joints, because they are located there, the tibia with its interosseous membrane. I hope you know what's a tibia and a fibula. Both of them are related with something called as interosseous membrane. It is the nerve which supplies to it. Do you remember this common peroneal branch is just a very small branch. If tibial is a large terminating branch, common peroneal is a small terminating branch. It arises from the superior angle towards the lateral, not the inferior, please. Do remember, from the superior angle it descends towards the lateral angle. That's the medial border of the leg. It has very easy superficial branches and deep peroneal. I'll come back to them both later, but let's see the branches of the proper branches of common peroneal. Got something called cutaneous. They're going to the lateral cutaneous nerve of the calf, supplying the skin of the upper 2/3 of the lateral surface of the leg. That is a lateral cutaneous nerve of the calf. Then you got a peroneal cutaneous nerve, which just joins with the sural nerve, and they form their own plexus and goes on. Articular branches of the superior genicular nerve, superior lateral genicular nerve, inferior lateral genicular nerve, and the recurrent genicular nerve, which goes and supplies into this packet actually divides into a superficial as well as into a deep component. And that's a very simple way to explain the tibial component and the common peroneal component. I'll come back to something very important in this region. You have to know about sciatic nerve. Both the medical and the physiotherapist students should know there's something called as sciatica. What is sleeping foot? What is this piriformis syndrome? The pressure of this particular sciatic nerve, the pain in the lower back as well as the buttocks. You have to know something called sciatica, which is called as a bone shave. And depending upon the symptoms on the division and site of injury, before division, the common peroneal nerve and the tibial nerve are affected. Before and after division also, the motor loss will be not able to extend the thigh, flex the knee, loss of all movements of the below the knee, high stepping gait, that is walking. Got something called foot drop, you can observe this, and got sensory loss, all loss of sensation, not in Zephanius. Now this is a very pathetic condition. Just to study in detail about what is sleeping foot, I want to know what is the shooting pain seen in the case of sciatica, and may be injured by perforating dislocation of the hip joint. It gets injured, and sciatic nerve creates lots of problems in applied aspects. Go ahead, read the book, and this video is tried to make a simple understanding method for you to understand between sciatic, its tibial component, and the common peroneal component. I hope you enjoyed my video. Do subscribe and like it if you only like it.